We are in the last stretch of Bloomberg TV India's special series in the run-up to Budget 2015, Ideas for Transforming India. I'm Siddharth Zarabi. All of this month, we've got you the big-ticket ideas that can bring radical change. We've covered areas from energy independence to infrastructure, housing, as well as digital India and Make in India too. Close on the heels of the Clean India mission, the government is now working on a Healthy India mission. This concept of Swasth Bharat is likely to be closely linked to the objectives of Swacch Bharat. The Prime Minister has also called for universal health insurance in the country. Joining me now to talk about the radical changes in India's healthcare system that are needed, Dr. Naresh Trehan, Chairman of CII's National Committee on Healthcare, Atit Jain, General Secretary of Mission Swasth Bharat, and J. Harinarayan, former Chairman of India's insurance regulator, the IRDA. Thank you very much, gentlemen, for sparing your time to discuss Swasth Bharat. Clearly, the most important thing as far as this country goes, if this country is healthy, only then will its economy grow. Only then will its people have happiness and prosperity all around. And given the mounting problems that we see, both related to lifestyle and the availability of Medicare all across this country, this is a huge issue that stares India's 1.2 billion people right up there in the face. Coming to you, Dr. Trehan, first, for your first big idea that you would want to propose at this time with regard to the objective of a Swasth Bharat for all Indians.
Well, the biggest challenge today is on the accessibility to healthcare. So what we are saying is today we really need to work hard on universal access to healthcare, which is a fundamental right of every citizen of a country. So I think even the government is sensitized to the fact and that there are programs on the way. So when we talk about Swacch Bharat, we talk about decreasing the disease burden. And when we talk about Swasth, we say, how do people access healthcare? In the delivery system, on the delivery side, there is enough capacity, but the capacity is divided into the government and private sector. So to actually improve the utilization of the capacity on the ground, we need to break down the firewalls between government and private sector and utilize it as one healthcare delivery system and tier it in a way that everybody can participate at affordable cost. So this is the main thing that we need to achieve actually right now, because people are impatient. People have been exposed to the idea of Swacch Bharat, Swasth Bharat, achhe din aane wale hain, and you know the displeasure people have actually expressed in the last elections, that they still have not been touched. And I think that we do not have much time. The government also realizes it, I think, and that I think that the sooner and faster we get on track and show the results, the better off India will be.
The insurance aspect I'm going to ask Mr. Harinarayan to speak about, but if you could sort of tackle this issue and also give us your suggestions and ideas as far as the affordability of healthcare for a country where more than half of the population lives at very depressed daily wage levels.
See, you need to understand that what procedure, what disease are we talking about? So when you have high-end, you can say tertiary disease like heart, like cancer, like bone and joint, like neuro, these are expensive, relatively expensive, although they are performed at 1/10 the cost of them being performed in America or in Europe. So you're saying it is accessible to our public, same standard, better results at 1/10 the cost. But the tragedy is that even that is too high for our Indian population. So we are saying accessibility means two things. One, you do realistic costing in the hands of the facility that you're talking about. If you have a facility which has the controlled environment, all the other facilities that you expect to have the lowest infection rate, the best results comparable to anybody anywhere in the world, you will have to fix a price for that. And that realistic price should be reimbursed to these institutions. It's been done in the United States for many, many years. So we need to get down to the ground and say, what is the unit cost of delivering a care in a certain facility? The government has many hidden costs which does not come out per unit, but if you compare it unit to unit, I don't think there's a much difference between the cost that the private sector charges or the cost to delivering it in the government hospital, because these hidden costs added up actually come to the same cost. Second thing I'm saying is,
right,
accessibility means, if you look at, and I'm sure my dear friend Hari Narayan can throw more light, but we did some back of the envelope calculations, and we have suggested it to the government. Increase the RSBY from 30,000 to 60,000. Also provide a 2 lakh cover to each family of 5 per year for major illnesses. If we are able to do that and we deliver this scheme efficiently with accountability, it will cost the entire country 18,000 crores. 9,000 crores the government will have to bear for the BPL patients who can't afford to give any premiums, but the EWS and the unorganized sector employees can pay 100 rupees a month and be covered in this insurance scheme. So 9,000 comes from the public, 9,000 comes from the government. For 18,000, we should be able to provide good quality healthcare in the government and in private sector, because you must understand the private sector has 15 to 20% capacity which is available, and private sector is also present in B, C cities. It's not like there's, may not be in a village, but you know that it's very difficult to put a full system and a doctor in the village. We don't have enough doctors, we don't have enough nurses. So we have to come up with innovative solutions like mobile care, like ambulances. We have to do PPP models with the government and the government public hospitals, and private hospitals can supplement each other. The government can be a buyer of tertiary care, because there are many hospitals built by governments, but they have not been able to staff them. So we don't have to have capital expenditure. We just need to concentrate how to make it accessible, use the entire asset on the ground, healthcare ground together, and I think that from tomorrow, we will see a change. We will see a drop in maternal mortality, we will see infant deaths going down, we will see people not losing their lives because of heart attacks or strokes. I think we can be proud of India if we do it right. We have made some suggestions to the government. The budget will tell us how much of it has got any traction, and I'm hoping that today, together, and the health and the private sector is also aroused with the excitement of being able to participate in providing health care to the rest of India. So I think the alignment is right. How we utilize it and how deft we are in aligning our services will make a huge difference to the future of India. And by the way, it will create 9 million more jobs.